And we explained it who Gianna was to people here. And we've been just talking about some of the procedures that a Catholic gynecologist or doctor working with newborn babies is going to be guiding by. We know, all of us, that there are many things in this area that are acceptable, unfortunately, but are contrary to the divine law. Not just against, they're not particularly against the teaching of the Catholic Church, they're against the divine will, they're against the scriptures, but people only understand them when they're taught by the Church. In your own work, what do you find some of the great issues that would come to a Catholic gynecologist?
Father, honestly, the OBGYNs and physicians who do reproductive health care, they're the doctors that stand on the front lines in the pro-life movement. And in fact, in medicine in general, physicians are the ones who stand on the front lines. Every single assault on human life occurs in medicine. Every single one.
Everything.
And many of them occur in women's health. And so a pro-life physician, and specifically a pro-life physician who follows the Church's teachings also on contraception, is very hard to find. And part of the reason for that is because of the challenges in becoming a physician if you stand by those values, both through medical training and medical residency and then even in practice. And so physicians who believe these things strongly face very real discrimination at every point of the process of becoming a physician. And yet, physicians are most needed in those areas.
Would you say that when medical schools that would be identified as Catholic medical schools, it's a kind of questionable point of view, are they strongly teaching the teaching of the Church in this regard?
Father, I didn't attend a Catholic medical school, but what I can tell you is the training that I've done in Catholic hospitals, the principles were actually very directly undermined in the teaching that I received there. In fact, I did my OBGYN training as a student in a Catholic hospital, and the chairman of the OBGYN department told me I didn't have the right to become a doctor if I wasn't willing to prescribe contraception.
Which is openly contrary to the teaching of the Church. And don't be surprised at this. What you ought to do, if you're surprised, is read the Bible. Read the Old Testament. And read when the people of God, the people of Israel, were doing very well. They were ignoring the divine law very easily. Only when things fell apart and the prophets came out, then people were beginning to listen. And, you know, much of this happened in Europe. After the First World War, Europe and the United States less went into a moral blackout, the so-called Roaring '20s. And there was, for the first time in the United States, there was a real public ignoring of the divine law. And the persecution of the Church in Mexico did nothing to stop it. The Knights of Columbus asked the president to intervene in Mexico, the murdering of priests, bishops, burning of churches. He did nothing. And in Europe, much went on. And where did we come? To the Second World War. the great philosopher and theologian Monsignor Romano Guardini, in his book called The End of the Modern World, says and points out that we are moving in exactly the same direction now. And certainly we see, possibly in the United States and in Europe, a complete loss of moorings with morality. And great numbers of well-meaning people are completely unaware of moral requirements. You know, the severe criticism of Pope Paul VI when he put out the encyclical Humani
Vitae.
Humani Vitae. That was part of the whole thing. Well, now we've got two living Catholic physicians, both of them working in the area of the OBGYN. What have I got here? Let's give us some ideas.
Well, actually, one thing as you were talking came to my mind. You know, a lot of the media and maybe people in general think of Catholic medical ethics as a list of negatives: no abortion, no contraception, no sterilization, and so they view Catholic ethics with a very kind of restrictive mindset. And you don't want to get involved in that. When actually, I think actually the converse is true. Catholic ethics centers on the value of the human person in their totality. So it's more than just a list of negatives. It's a real positive of, as John Paul II would put it, a true anthropology of who the human person is and the dignity that they carry from the moment of conception through natural death. And so in the world of OBGYN, that's how Dr. Mielnik and I practice. And there's a new science called naprotechnology that I feel goes a far way towards showing that if you follow good ethics, you can get positive outcomes, which can at least meet, if not excel, what's available in conventional obstetrics and gynecology. So
now, give me that word again.
Naprotechnology.
Okay, let's run that one by for our audience.
Technology.
Yeah. Tell me what it means.
Yeah. Well, it stands for natural procreative technology, and the basic thought behind it is that the human body is much more wonderful than anything artificial that we can come up with. So the best we can hope to do is to assist it in its own natural functioning. And so the thought of working with a woman's menstrual cycle, first of all, analyzing it and looking at it, and seeing what we can observe about it, taking really careful observations of a woman's monthly cycles, that can uncover pathologies that most doctors overlook because they put every woman on the pill for almost every problem there is in gynecology. So that has gone a long way. It's been developing for the past 30 years, and it's come a long way in recognizing and fostering new treatments in women's health care.
Yeah. So, Father, this is a key thing that you're asking, and that is this battle for the lives of the unborn and for women is only going to be won if we can hold out the positive alternative to the things that we are saying to people don't do. Because the longings of the human heart are so deep. And we see this most, I think, maybe most powerfully demonstrated in infertile couples